Hi, I'm with Dr. Kevin Sharon now he's the medical director from Clinica Mi Salud, and we're going to talk a little bit about the public health perspective of Naegleria fowleri. And Dr. Sharon, welcome.
Thank you.
Okay, well, gonorrhea, salmonella, these are all reportable diseases in all states. Is Naegleria fowleri a reportable disease? And if it's not, should it be?
Well, in Florida, Texas, and Louisiana, it is a reportable disease, thankfully. And it is the southern tier of the United States that has seen more of these cases, so that's important to know about it. It seems unusual that states like Mississippi and Alabama have been completely skipped in this disease. So yes, I believe it should be reportable because that's how we're going to know how many cases there are. There have been cases found throughout the United States and more in the northern tier in recent years.
So do you suspect the number is probably higher than
Absolutely.
Actually is, yeah. Being an expert in public health, what is your message to the public concerning Naegleria risk and prevention?
Well, first of all, I think one of the new pieces of information that we have is that any fresh water that doesn't have saline in it is a risk, or poorly chlorinated pools. So we know that we need to maintain pools properly. If you're swimming in a pool, you want to make sure that the chlorine levels are adequate and the pH is tested on a regular basis. Now, freshwater swimming is usually thought of as the highest risk for Naegleria, but it has happened in other circumstances. Let me give you an example. Neti pots. So a lot of people have sinus problems, but you have to use the neti pots appropriately. And you have to, distill the water so that it does not contain any of these organisms. So proper distillation, heating, maintenance of the neti pots, cleaning them out, those are very important to know. It has even been found in water supplies. There were 2 cases in Louisiana, and they found that the tap water that went into the neti pots in 2011, I believe, it was related to, they developed Naegleria. So there are all sorts of different ways that we place ourselves at risk of Naegleria. It's not just the child who's wakeboarding or their head gets hit into the water very hard because of diving and such. That it's anything that forces water up the nose, and if it's fresh water, it has the potential of carrying this Naegleria.
Mm-hmm. Now, as a public health professional, where do you see, Naegleria is becoming more and more well known to the public over the years since I started in the laboratory many years ago. Where should public health policy be going today?
For this particular disease?
Yeah.
Well, I think number one, we want people to know what the case definition is, and that, of course, is laboratory confirmation in the clinical set of circumstances. Number two, I think CSTE in the past, I think it was 2016, did look at making it a nationally notifiable disease. So you could talk about U.S. public health policy or globally. Since this is a global disease, there's
Sure.
an outbreak in Karachi at the moment.
Right.
And no nation that I know of has it as a nationally notifiable disease. So public health policy should probably move beyond Florida, Texas, and Louisiana and say, how can we make this more widely reportable? That would be my first thing.
Mm-hmm. And as a family practice physician by trade, last question, what's your recommendations for actions in the hospital ER?
Well, absolutely. That's a great question. So there's 2 things. One is you want to have a rapid diagnosis. So the antigen testing that's available for central spinal fluid material, your CSF, your lumbar puncture, you want to have the ability to assay for this particular organism. I've been told the N multiplex is a multi-channel analyzer for this material that can be used. You want your laboratorians to be trained in identifying the organism. And the old way is the wet mount and looking at it under the microscope. And the training here at Advent Health is superior for this.
Correct.
And they've developed a national video. And number 3, you want to be able to begin treatment on basis of suspicion only, that you not wait until this clinical laboratory confirmation, but when you suspect this disease, the child with the headache and the fever, for example, you can institute effective treatment and it's multi-drug treatment, and we know today that a medicine called miltefosine is effective. So does your ED stock miltefosine? Do you have these abilities to do rapid diagnostic testing in your ED? Most of it will come to the ED, not to the pediatrician or the family physician.
Right. Well, Dr. Kevin Sharon, I appreciate your time. Thanks.
Thanks a lot.
All right.